Dear colleagues, ladies and gentlemen, my name is Dragana Zivkovic and I am pediatric urologist at the Institute of Child and Youth Healthcare of Vojvodina in Novi Sad, Serbia. Among other things, I'm dealing with voiding disorders in children, and I would like to present our experience with pelvic floor muscle training in treatment of lower urinary tract disorders in children. I have no additional affiliations or financial ties to disclose. Lower urinary tract symptoms in children are divided in three groups. Those are storage symptoms that include increased or decreased voiding frequency, incontinence, urgency, and nocturia. Voiding symptoms that include hesitancy, straining, weak stream, intermittency, and dysuria. And other symptoms including holding maneuvers, feeling of incomplete emptying, urinary retention, post-micturition dribble, and spraying of the urinary stream. Our treatment protocol encompasses careful patient and voiding history, physical examination, and urinalysis at the first checkup, with fulfilled voiding diaries, dysfunctional voiding questionnaires, and uroflowmetry with or without EMG at the second visit. Sometimes ultrasound with residual volume is needed, and in certain selected patients in whom a diagnosis is not clear may need urodynamic examination as well. The aim of our study was to analyze the effects of pelvic floor muscle exercises with biofeedback in children with different lower urinary tract symptoms. We conducted a prospective study analyzing the effects of those exercises. All of the patients were fully evaluated prior to inclusion in the study. Urotherapy was advised to all of the patients that included voiding in the right position, timed fluid intake, and timed voiding. Patients that still had lower urinary tract symptoms after urotherapy were included in the study. All of them fulfilled the voiding diaries, validated National Dysfunctional Voiding Symptoms Score questionnaire, and they have performed Uroflow EMG prior to the start of the treatment. Our treatment protocol encompasses 10 consecutive daily sessions with urotherapist. After the completion of the treatment, voiding diaries, questionnaires, and pressure flow studies with EMG were repeated and data were analyzed. Total of 79 patients with lower urinary tract symptoms were included in the study. 16 patients had idiopathic detrusor overactivity, 7 patients had hesitancy, 5 patients had giggle incontinence, 15 patients had both detrusor overactivity and detrusor sphincter dysynergia, and 36 patients had isolated detrusor sphincter dysynergia. Total of 63 patients had their symptoms ameliorated. The analyzed data showed no measurable improvement in additional 4 patients, even though they reported a personal impression of an improvement. 12 patients without the positive effect of the therapy were either immature or non-cooperative. As you can see from the graphs, almost 80% of all patients, independent of their condition, had a measurable improvement after the treatment. Pelvic floor muscle exercises with the addition of biofeedback have a goal to make children aware of their pelvic floor musculature and to teach them functional ways of using these muscles. Although the main indication for initiating this therapy is detrusor sphincter dysynergia, the study showed an improvement of symptoms in patients with other lower urinary tract symptoms as well. Pelvic floor exercises with biofeedback are a very useful tool in treatment of various lower urinary tract symptoms in pediatric population. Thank you for your attention.